Hey guys, welcome back to my channel. Today I was planning on doing a video of the books that I used for my first year of nursing school, the must-haves to get you through your first year. And I will tell you, I swear by all of these books. You'll probably hear me say I highly recommend this book a lot during this vlog because I highly recommend all of these books, which is why I'm doing this video. So let's start with fundamentals, and we're just gonna jump right in. Fundamentals was my first trimester of my first year of nursing school. So one of the books that I used was Fundamentals of Nursing, Made Incredibly Easy, okay? So guys, this book can be a little spendy, but if you buy it used, you'll get it way cheaper than if you buy it full price. So anything that's on their website is obviously going to be full price, but if you can find it used, it's definitely worth it. Mine was $42.95 and I bought it used, but if you can't find it used, just go to the website and buy it because I swear by it, you will love it. So let me tell you what this book basically does. When you're going through nursing school, they go through concepts, which is like you're going over the concept of like heart defects or things like that. So what a Made Incredibly Easy book does is it takes that concept and it breaks it down into all the very important things that you need to know based on that one concept without all the filler information. So these make it so much easier to understand what you're learning in nursing school and way easier for you to study. So this is an excess book that I got. My nursing program does not require this, but I will say for all of you that are going into nursing school or might be in your first year right now, I would require this if I was a nursing instructor because it helps tremendously. So again, Fundamentals of Nursing, Made Incredibly Easy. Please go get it. ATI books. So for my program, they actually require ATI because we do ATI proctored exams, and this is part of the curriculum that they use in my program. But if they don't use it in yours, I would highly recommend this too. See, here we go, highly recommend. I think I already said that. But this is what it looks like. It's called Fundamentals of Nursing Content Mastery Series. So this is similar to the Made Easy books, but this goes along with the NCLEX exams. So things that are in here, you're likely to see on your NCLEX exam. The Made Incredibly Easy is basically for you to understand what you're doing in nursing school. I wouldn't suggest using that to study for NCLEX, but an ATI book you can definitely use to study for NCLEX and study the questions out of here before exams. So let me just give you an example of how this looks. So I highlight all the things that we talk about in lecture so that I know that it's important and it's going to be on the exam. Then what I do is I will take notes. I'll write notes on things. And basically how it works is I'll pick a topic, I'll write down everything I know about the topic, then I'll go back through the ATI chapter and see if I missed anything. Guys, this is literally the best way for you to study and learn because it's testing the knowledge that you already have. So if you pick a topic, so one of my topics is safety. So you would go and write everything that you know about safety that this chapter has already spoken about, and then go back to the topic of safety and see if you missed any big concepts or big key factors in safety. And if you did, then just study those things. You don't have to keep studying the same things over and over again if you already know it. Just write down what you already know about a topic and then go back and study the stuff that you missed under that topic. It will save you a ton of time and it will make your studying way more effective and time efficient. I would definitely get this if your program doesn't require it. Okay, the next thing, so what I did, part of the way that I studied before exams was I did a ton of practice questions. So I think I probably did around like 500 practice questions before every exam, and I would do it online. We had practice questions in ATI, and then the program that we use is called Course Point, and we also had like questions in there that went along with the book that we have for nursing school, and I would do questions in there. But books, these are amazing. For one, because you can take them anywhere you want and study all the time, which you will find yourself doing a lot because nursing school is all about studying. I swear that was my life the entire year, and I'm getting ready to go back into that being my life once again. But these are great because this is all NCLEX style questions. I would actually suggest getting all the success books for when you actually do study for NCLEX. In addition to some other books that I can show you at a different time, but this helped me a lot in fundamentals. So I would go through and study some of the questions. I'll show you what it looks like. And it has tons of questions on the topics that you're learning, and then it has all the answers too. So this is what it looks like. It's literally just a testing book. So I would go through and highlight the answers I thought they were, and then check in the back. And one of the most important things that you have to do when you're studying questions or doing questions is to make sure that you know the stem of the question. What is it actually asking you? Because you can get tripped up on questions on exams, because I'm sure most of you have heard that on exams you'll have answers and all of them are right, but one of them is the most right, which is true, oddly enough, and it's kind of weird to think that, but if you know what the question is asking you, it'll make it a lot easier to deduce what the right answer is. And one thing for me that I'll do is I'll read a question and then I'll go through A, B, C, and D and go in a true or false kind of fashion, like read the question and then A or B, is it true or false regarding the question? And if it's false, then you move on to the next one, and so on and so forth. And that helps you actually eliminate a lot of the right answers. Again, fundamentals of success would definitely get this. So like I said in the previous video, I did fundamentals first for my first trimester. Then I had PCH, which is parent-child health. It's pediatrics and labor and delivery. And then my third trimester, I had mental health. But before I move on, I'm gonna show you a couple books that I used for fundamentals that I also used for the rest of the trimesters, but I wanna just show you in the beginning so I don't have to show you later. So the nursing care plans book. Okay, there are tons of these online. You could probably just look up any nursing care plan book and get it. This one is amazing. I really liked it. It's by Meg Golinek and Judith L. Myers. Okay, so I have the Nursing Care Plans 8th edition. So basically what this is all nursing programs are gonna require you to do concept maps or nursing care plans. I've never heard it called anything other than either a nursing care plan or a concept map, but basically what it is you are taking a patient and you're giving that patient a nursing diagnosis, and then after you figure out what your nursing diagnosis is for your patient, you have to then write interventions for that diagnosis. So for an example, say your client is at risk for an infection. So your nursing diagnosis would be risk for infection. Then you, as the nurse, will have to write out interventions to prevent your patient from getting the infection that they are at risk for. And then after that, you're gonna do expected outcomes, meaning after you do your diagnosis, you do your interventions for the diagnosis. What do you expect to see in your patient? How are they gonna be different than they were when you diagnosed them? So you find all your diagnosis and interventions from your head to toe assessments in nursing school. So that is one thing I actually forgot to mention. When I showed you guys the fundamentals of nursing made incredibly easy, it goes in depth on your head to toe assessments, and head to toe assessments are essential in fundamentals. That's literally what you're doing the entire semester, is you're learning how to check someone from their head to their literal toes. Anything that could be wrong, things that shouldn't be there, why they're there, if they are there, what it could mean that's happening in their body. And then just the regular routine things that you're gonna do is your TPR, so it's temperature, pulse, and respiratory rate. So how fast are they breathing? What's their temperature? What's their pulse? Then you're obviously gonna listen to lungs and things like that, but that's all in your assessment. And then after your assessment is when you do your nursing care plan. And guys, they take forever. They were literally the bane of my existence when I did them. They take a long, long time, and you have to put thought into it, and you have to really actually work hard at them for it to make sense for your patient. So this book actually has tons of examples, like literally tons of examples. So like I used the risk for infection as a probable diagnosis for somebody. This book will have the interventions that you can do and what your expected outcomes should be. So I would highly suggest one of these for you guys, because it'll save you a lot of time and it'll make things make a lot more sense. So highly recommend. Okay, I'm gonna stop saying highly recommend, because like I said in the beginning, all these books are highly recommended. Okay, so the next book is Pharmacology Made Incredibly Easy. I don't know if you guys have heard anyone talk about pharmacology yet, but it's a lot of memorization and it's a lot to study and to understand. So this book will help you a ton, and it just makes things way easier. Like I said before, it'll help your study time be way more efficient and not as stressful. So highly suggest this book. I think this one I got for 40 bucks. So again, it's not too bad if you can find it used. So with the Made Easy books, I don't know if I already mentioned this, but my program does not require those books, but would require them if I was a nursing professor. So like I mentioned before, the nursing Made Easy books are not required by my program, but this next book is. So this is the Nurse's Drug Handbook, 2020 Handbook. So this basically will take all the drugs that you're learning in pharmacology. It'll tell you what the drug does, what it's intended for, what the proper dosage ranges are for these medications, what they can be used for. So what happens is when a physician prescribes a medication, there are medications that are intended for one thing but can be used for multiple things. So say it's like anti-epileptic medication, it can be used for several things, not just epileptic patients, if that makes sense. So there's other indications for it, but it's not like its primary use is for anti-epileptic. Does that make sense? Anyways, so this book will tell you everything you need to know about the drugs that you're learning about. And again, actually, when you go through fundamentals and pediatrics and labor and delivery and mental health, it'll have all the drugs that they use specifically for those things. So any drugs that would pertain to somebody with mental health issues, or somebody that's going into labor, or a medication that's safe for a child, it'll have all those drugs in here, so you know exactly what they are and what they do. And another thing is when you go into your clinicals, there's these things called, at least for my program, we had to do med sheets. And what that is you're gonna get assigned a patient and you go through their chart and all the medications that they're on, and you have to study all of their medications. So why is your patient getting this medication? Is it safe for them? Are they allergic to it? Is there anything that's in their chart that contradicts the medication that you're supposed to be giving them? Is it safe for their weight and their age based on what is prescribed to them? Is it the right route? Can they take things by mouth, or would it need to be injected? Can this medication even be injected? All those things you'll have to learn and know for the patients you're assigned. So this book saves you. Let me just tell you, you need a drug book. I think most programs would probably require that, but if they don't, get one, and get a little pocket-sized one to bring with you to clinical. So moving on to parent-child health, here we have the Pediatric, Made Incredibly Easy. I'm not going to go in depth with this because I've already talked about the past two Made Incredibly Easy books, but again, as you can tell, love, love, love these books, so would highly suggest. Next is the ATI. This one is the Nursing Care of Children. We use this for our pediatrics rotation. Again, this one is required by my school, but if you don't require it, or if your program doesn't require it, please get it. If you can get your hands on it somehow, I would highly suggest getting this, because another thing that is really nice about the ATI books is once you're actually graduated from nursing school, all the ATI books will help you study for your NCLEX. You need them. Then next we have the Maternal, Neonatal Nursing, Made Incredibly Easy. Love it. This one was amazing. I used this a ton in my labor and delivery rotation. Here we go, the ATI. Maternal Newborn Nursing. We're moving on to mental health. So I have the Psychiatric Nursing, Made Incredibly Easy. And then I have the ATI Mental Health. So that's about it, guys. Those are all the books I primarily used for my first year of nursing school. Obviously we do have like an actual fundamentals book, a parent-child health book, and a mental health book, but all of ours were virtual. They were just on the computer. We read them electronically, so I don't actually have like a physical copy of the ones that we used, but those are all the excess books I used other than ATI books because they were, again, required by my program. But again, I can't say this enough, you guys, if your program doesn't require it, get your hands on some because they will help you tremendously. I think that's it for today. If you guys have any other suggestions, let me know. I can actually do another video of the books that I got for this upcoming year. Again, it's probably a little repetitive because I have a lot more of the success books, a ton more of the Made Incredibly Easy books, and then a lot of med-surg books. When you move into med-surg, it's head to toe anatomy. Like, it goes in depth. You're gonna go over cardiology, you're gonna go over hematology, all those things. So it's really important to have as many things that can help you as possible. So I can do another video with the books I got for that. I also could do a video on nursing supply stuff that I have used so far in nursing school. I watched so many supply videos, you guys, before I started nursing school, and then I didn't even use half the stuff that they told me to get in supply videos. So I could do one of things I actually used versus the stuff that I bought that I probably wouldn't have gotten. And then if there's anything else you guys want to know about nursing school, if you're prepping for nursing school, if you are taking the TEAS exam, anything like that, let me know. I will help you guys out as much as I can. Thank you so much for being here today. If you made it to the end of this video, I really appreciate you. If you found this video to be helpful for you, please give it a thumbs up, subscribe, and follow me on this journey. Okay guys, see you next time. Bye.